The Chatty Dentist provides general advice and insights on patient communication in dentistry. However, we want to make it clear that we are not affiliated with any dental council or professional organization. The information shared in this podcast is for educational and informational purposes only. We want to emphasize that the content presented on the Chatty Dentist should not be considered as professional, specific, or personalized advice for individual cases. We do not make any guarantees or warranties regarding the accuracy, completeness, or applicability of the strategies discussed. It's important to note that the dental regulations, standards of practice, and professional guidelines may vary significantly by region. Therefore, listeners are strongly encouraged to consult with qualified professionals or relevant authorities in their respective areas for specific guidance tailored to their unique circumstances. By listening to the Chatty Dentist, you acknowledge and agree that the podcast hosts, guests, and producers bear no responsibility or liability for any actions taken or decisions made based on the information provided in the podcast. We disclaim all liability for any direct, indirect, incidental, consequential, or punitive damages arising out of your use or reliance on the podcast content. If you want to get in touch with us, please email us at ask@thechattydentist.com. We want to acknowledge the Burunong people of the Kulin Nation as the traditional custodians of the land we are speaking from. We want to recognize their continuing connection to land, waters, and culture and pay our respects to their elders, past, present, and emerging.
Miss Smith is a 30-year-old regular patient to your clinic complaining of pain from her upper right back tooth. In the last dental visit, you gave her the diagnosis of irreversible pulpitis in tooth 3-6. She doesn't want to lose the tooth. She is medically fit and healthy. Address the patient's concerns, explain the procedure, and gain informed consent for endodontic treatment.
Here the pointers would be we must reconfirm the diagnosis. We must give all the treatment options and focus on endodontic treatment as the patient prefers that treatment over exodontia. Then we must explain the entire root canal process comprehensively. Let's go into the role play now. Hi Mrs. Smith, welcome back to our surgery. How are you feeling?
Thank you, I'm good, thank you.
That's good. So let's discuss about what we have seen in our last appointment. So if you remember, we spoke about the diagnosis, which was irreversible pulpitis. So how's the pain today?
It's okay. Like I told you, increases when I lay down, but it's okay. I'm still taking Panadol.
Okay, that's good. We'll definitely do something about it now. Now that we have all our information with us, and I've done a few pictures of the tooth as well. So if you remember, you had a lot of pain because the tooth was very badly broken down.
Yes.
Yeah.
Yes.
So I'm just reconfirming again medical history. I know you said you're medically fit and well. So is that right? No medications, no allergies?
Yeah, I'm fine, all good.
Okay, that's great. So the treatment options for this condition would be, we could always do nothing, but that's not an option because you're in a lot of pain and we really have to do something about it. The other option is the root canal treatment, which we are going to go over in detail today. I know that taking the tooth out is not an option for you either because you're keen to save this tooth, right? All right. So with the root canal treatment, it is a bit of a lengthy treatment. It's done in about 3 to 4 appointments. What we do is we'll numb you up first, and then we'll put a rubber sheet, which is called as a rubber dam, and then we'll go in, take out all the decay around where the tooth has broken down. And once we've removed the decay, we'll also remove the nerve and the blood supply around there, which whatever is actually causing you that pain.
Okay.
And once that's taken out, we'll clean and we'll shape those canals, and we'll put some medication in there, and we'll also just use a lot of antiseptic solutions there to clear the canals and keep it bacteria free.
Okay.
Is that all clear so far?
So far, so good.
That's good. And once we do that, we'll fill these canals with an inert material, which is a bit like rubber.
Okay.
And once we fill that up, it's all nicely cleaned, shaped, and we fill it up, and it seals this tooth from the outside environment.
Okay.
And that stops any bacteria, any other future decay from happening again.
Okay. And there's no more pain.
Yes, absolutely. So the whole aim is that we keep the teeth in their place, but we remove the source of the infection from it.
Okay.
All right. And once this is done, and while we are waiting for the tooth to recover, and once I'm happy with what I've seen after the treatment is done, that's when we will discuss about how to permanently fill this tooth. So this tooth needs a more definitive cover on top after the root canal treatment is done. So you do have a few options there.
Okay.
We can do a filling and then make sure that it's healing well, and after once I'm happy and everything's good, then we can put a crown on top of the tooth. So that's a separate appointment, but we'll only do it once we finished the entire procedure.
And it's covered in the cost of the root canal.
That is extra, unfortunately. Yeah, a cap on the tooth is comes separately.
Okay.
But like I said, there's no hurry to discuss that now. It's something that you should be aware of, but it's definitely something that we will do once the treatment is complete.
Okay.
All right. I do have to inform you about some possible risks and complications that can occur during the treatment. The most common ones would be that sometimes while we are, doing the procedure, you can experience a little bit of pain and discomfort.
Okay.
These instruments that we use are very fine. So it's rare, but sometimes they can separate or break within the canals. Sometimes we use all the information that we have with the images, the x-rays and everything. Despite that, there is a chance that sometimes we can miss a canal. And despite the treatment, sometimes the tooth will not respond. It can still get infection. It might be reinfected as well.
Okay.
And some people experience a bit more prolonged pain after the treatment. Rarely there can be a risk of perforation as well. So if you remember, I told you that we'd be using like really fine instruments and a drill to get through it. Very rarely it can perforate the tooth as well. There's something called as ledging that can occur. So the canal itself might lose its position while we are shaping it, and that leads to what is called as ledging as well. The antiseptic solutions can also lead to certain accidents in some situations while we are just irrigating it inside the canal. Tooth can also undergo a color change. Sometimes root canal treated teeth can appear a bit darker. So discoloration is also a risk.
Sounds like a lot.
I'm sorry that it sounds like there's too much for you to take in.
Yeah, I can't wrap my head over half the things you said.
I understand, and I assure you, Mrs. Smith, we will give you a good literature handed out to you today for you to have a look and read about it as well, so that you're fully aware of it. And like I said, these are all expected complications, but they may not always happen with every treatment, but this is something that it's important that you're aware of it.
Yeah.
All right.
I think you stated a lot, or maybe all of them, because the complication list was longer than your procedure list.
Absolutely. Yes, I agree. And once we have completed the procedure, if there is a situation where the tooth is not responding and there is reinfection, or say any of these complications have occurred while I was doing the treatment, there would then be a possibility that I'll have to refer you to see a specialist. So who would then be taking it over from there.
Yeah, looking at the complications list, it's quite scary.
Yeah, I know. But like I said, it's only some of those things that can occur, and I'm meant to inform you.
These complications can occur with the specialist as well, right? It's not just because you are doing it. And
100% well said, Ms. Smith. Yes, this can occur.
And then that makes sense that, we could start with you, because it's not something you are looking at.
Yes, that's right. Because as with any treatment in medicine and dentistry, everything comes with a set of risks and complications. So you're absolutely right. The same protocol applies to a specialist treatment as well. But like I said, I'm here to make sure that, this is a comfortable and a safe experience for you. And we will always do our best to help you out.
Yes, thank you.
So once this treatment is done, I'd like to review you again in a few weeks' time, once we're finished with the entire treatment. And at that point, yes, we can discuss about the long-term option of how are we going to protect this root canal treated tooth, that's when we can discuss a little further about caps and the options that you have. And to prevent this from happening again, I would definitely urge you to come back and see us for regular visits. That way we are able to care and maintain all the other teeth, offer preventative care, and just make sure that, we don't have any other teeth which would land up in the situation.
Yes. Oh yeah, after going through the pain, I understand. Prevention is better than cure.
Absolutely. Yeah. I'm glad we are on the same page there,
Yes.
Mrs. Smith. Is there anything else that you'd like to ask me?
Just that if any of these complications come, are you going to try to solve it yourself? Because it's, I don't know how long it takes to get into the specialist books, and that's quite scary to start off,
Yes, that's right. As with anything, we will always try our best to manage this in my surgery setup.
Okay.
But if for any reason I feel that a specialist would better handle this, then yes, at that point I will definitely let you know, and we will try our best to triage your referral to the specialist.
Okay.
Yeah. Are there any other questions or anything else that you'd like me to go over with you again?
No, I think I'm quite clear.
That's good. Are you happy for us to start with the procedure today?
Yes, please. Yes.
Okay, that's good.